We're getting a lot of concerns from our patients who've had liver transplants about the coronavirus that is currently a pandemic. And fortunately, we've had a lot of communications in the liver transplant community with providers from around the entire world. And because this is so widespread, there's actually quite a bit of experience in caring for patients who've had organ transplantation around the world. Fortunately, our patients who've had liver transplantations do not seem to be as high of risk as recipients of other organs such as lung transplants or kidney transplants, but we do think there may be an increased risk for our patients. Of course, the medications that are immunosuppressive may place patients at increased risks of infectious complications, but we also know that people after liver transplantation have a higher rate of weight gain, the development of high blood pressure, diabetes, as well as some kidney dysfunction, all of which can place patients at higher risk as well. Therefore, it's very important that patients who have had organ transplants, including liver transplantation, should be taking a lot of precautions when they're out in the community. We're recommending that our patients use face masks when they're out in communities. We should be avoiding large crowds. Frequent hand washing is very important. Washing common surfaces is very important, and avoiding any unnecessary travel if possible. It's also very important to recognize that hospitals are taking a lot of precautions to try to prevent the spread of coronavirus in patients. Therefore, if you need to go to a hospital, you can be reassured that those hospitals are taking precautions to help prevent disease prevention. If you need to get to a hospital, you need to go, and don't worry about coronavirus. The hospitals will be taking precautions. That being said, we also recommend that people use telemedicine if possible and take precautions about work. If you can do work from home, that's possible. You can talk with your employer. You can also talk with your transplant team with regards to whatever recommendations they might make with regards to your personal situation. It's also very important that we not stop medications because of the risk of rejection. It's also very important that people not be taking unproven medications to help prevent the risks of coronavirus. If these medicines don't have proven benefit, they also may have significant risk of drug interactions with the medicines that you're already taking for your liver transplant. Therefore, if there's any desire to take these medications, please talk with your transplant team before trying to start these so that we can know if they're safe to use. Thank you.